This short video is about seizures in cats. These are also known as convulsions or fits, and if your cat has a seizure, it can be terribly distressing, and that's why it's important that you understand what's going on. So essentially, a seizure is the consequence of abnormal electrical activity in the brain. Normally, the electrical activity in the brain carries on at a steady low level. Sometimes, for different reasons, the electrical activity in the brain peaks suddenly, and during that peak it goes over what's called the seizure threshold, and when it goes over the seizure threshold, the body reacts dramatically by muscles twitching and flailing around, and that's called a seizure. So essentially, seizures can happen because of a number of different reasons, and they're very broadly split into two groups. First of all, partial seizures, where there's just a small part of the brain perhaps is got electrical activity going on in an excessive way, and you get a small part of the body reacting in an exaggerated random way. So a cat might have a twitching eyelid or twitching side of the face or just one limb flailing around. That's called a partial seizure. More commonly, we see generalized seizures, where the animal falls over onto their side and their legs are flailing around and they've lost consciousness and the whole thing is going on. And that's what would be called a classical generalized seizure or fit or convulsion that people would know about probably. So the key issue when your cat has a seizure is what is the cause. That's always the key issue with veterinary issues. What's actually making this happen? And so if you consider what the possible causes are, they're generally split into extracranial and intracranial causes. So extracranial causes would mean issues like poisoning, some viral diseases, some bacterial diseases, so some metabolic issues, for example, like if an animal is overheated, if they're having heat stroke, if they've got diabetes mellitus. So in other words, more generalized conditions which also happen to affect the brain. So that's the extracranial causes. Then there's the intracranial causes, and that means things inside the brain. So there could be, for example, like a young cat could be born with a brain that's congenitally abnormal, such as cerebellar hypoplasia, or an older cat that could be a brain tumor that's putting pressure in the brain that's causing this to happen. And there's a lot of other causes as well of just different brain diseases which can lead to seizures. So if your cat has a seizure, you do need to go to the vet, and the vet will try to work out what is the primary cause, what is making this happen. And they would do this generally by carrying out an investigation. It would start off with blood tests, urine tests, it would move on to ultrasound and x-rays, and then further diagnostic imaging that would include things like CT scans, MRI scans, and sometimes sampling of fluid from the brain. That's called CSF fluid, and vets take a sample from the back of the neck, and they use that to work out the changes happening around the brain directly. So often these tests will give a diagnosis as to the primary cause of the seizures. Other times, regardless of what work is done, no primary cause can be found. And in those cases are classified as epilepsy, which is also known as primary epilepsy or idiopathic epilepsy. And that means that there's no structural abnormality at all, that the seizure is just happening for reasons that we don't understand. Electrical activity is just spontaneously happening in a random way during the seizure. So those are the causes. I suppose the big question is what actually happens when your cat has a seizure. Well, generally there are three stages to the seizure. The first stage is known as the prodromal phase. And what that means is that's the period leading up to the seizure, and your cat would then perhaps just be behaving a little bit strangely. You might notice them walking in an odd way. You might notice them staring a bit at the ceiling or something, just behaving a bit peculiarly. That's the prodromal stage. Then you have what's called the ictus, and that's the seizure itself. And generally there will be 6 things would go on when the cat's having a full-on seizure. First thing, the obvious thing, I suppose, the most obvious thing is that they fall onto their side and they're essentially unconscious. And it's important that you realise that your cat is not awake, not aware of what's going on. They fall on their side. Essentially, they are asleep as far as they're concerned. So loss of consciousness, that's the first thing. Second thing is random movements of the legs. So the cat will be flailing around with their front legs and their back legs as if they're running essentially on their side. As well as that, the third thing would be they'd often have urination and defecation as well, so they make a bit of a mess around themselves. And as well as that, you'd notice that their eyes would look peculiar because they'd be staring wildly, and you might think they look terrified. Remember, they're not conscious of this happening, but their eyes do look peculiar. They're also vocalizing often, and that can be distressing to witness as well, making loud vocal noises because their throat, the muscles of their throat are contracting as well, and so that's what happens. They make very loud yowls and they sound distressed. Remember, they're not, because they're not conscious. And the last thing that we tend to see is what's called autonomic activity, and that means things like salivation. There'd be a very rapid heart rate. Their body has gone into automatic mode, and so all sorts of things like that are going on. Again, the cats aren't aware of it. So what do you do if your cat does have a seizure? Well, what you should do, first of all, there's three things you should do. The first thing is move the cat to a safe place. Be very careful when if you pick them up. Safer really to put a towel out beside them and just quickly move them onto the towel, and then you can carry them on the towel like a stretcher, rather than actually trying to carry the cat's body itself. And you generally don't need to move the cat that's seizuring, but if they're in a place that's unsafe, like the top of stairs or near objects that they might bash into, then you are better to take them somewhere where there's a clear open space around them so they can just have their seizure and not harm themselves. That's the first thing you should do. Second thing you should do is time the seizure. So look at the clock when it starts, and then at the end of it, look at your watch or clock again, and that way you know how long it lasted. That's important information for the vet. The third thing you should do is take a video of the seizure. So you should get your mobile phone out. Once you're sure the cat's in a safe place and you've got that sort of stuff under control, take a video of the seizure happening. And by taking a video, you'll be gathering really useful information you can show your vet, and that will help them understand what kind of seizure it was. So, if your cat does have a seizure, first of all, you should know it doesn't last very long usually. It might last 30 seconds or 2 minutes or 3 minutes, usually no longer than that. So what you should do is wait until that's settled down, and then you phone the vet and say, look, my cat just had a seizure, what should I do? Now, if after 2 or 3 minutes your cat is continuing to seizure, you don't wait at all, you phone the vet straight away, because a cat that doesn't come out of a seizure needs to be brought out of the seizure, and that's the job for the vet. So you would, in those instances, have to take the cat to the vet while they're having their seizure, and the vet would give medication directly by injecting into the cat to bring them out of it. That's called status epilepticus. If that happens, it's very serious indeed, because when a cat is having that sort of seizure that is really prolonged, their breathing is irregular. That means the brain doesn't get enough oxygen, and it can end up brain damage if you're not careful. So for that reason, a generalized seizure has to get to the vet absolutely immediately. Now, if your cat just has the shorter seizure and comes out of it, which is a normal thing, you should still phone the vet, and you should still see the vet as soon as you can, because if the vet can take blood samples and so on immediately after the seizure, they're more likely to find abnormalities than if you take them to the vet the next day when the seizure's long in the past and any of those abnormalities may have gone back to normal. So seeing the vet promptly is really, really important. Now, if the vet identifies a primary cause, such as one of the ones I described, like viruses, tumours and all those kind of things, well, you absolutely need to get treatment for the primary cause to deal with the seizures. But in many cases, no primary cause is identified, and your cat has therefore got epilepsy. And in those cases, what has to happen is two things have to happen. First of all, the vet's going to have to give you ongoing daily medication for your cat to stop the seizures from recurring. Now, the vet wouldn't do that immediately after one seizure, but basically the vet would talk to you about how often these seizures have happened, and if a cat's having a seizure more often than, let's say, once every 6 weeks, then they would go on to this daily medication, and that would hopefully stop the seizures from happening at all. So that's the medication for cats with seizures, and what that is generally, by the way, is like a mild sedative which just dampens down the electrical activity in the brain a little bit, and it means that the electrical activity doesn't reach those peaks which cause the seizures to happen. So that's the medication. So you have to get medication for your cat. The second thing is you should keep a seizure diary. A seizure diary is really important. That's when you literally get a notepad and write down whenever your cat has the seizures. Write down the time, the date, and also write down the few things that happened around the seizure. What was your cat eating? Where had they been? Had there been any particular events that had happened around the seizure? then if you keep a seizure diary, you can then build up a pattern of what happens with your cat's seizures. And like I've said already, it's really important, in particular, how often the seizures happen. If your cat has a seizure once every 6 months, your vet will very likely say to you, we don't need to give medication to you, you just need to carry on keeping a seizure diary. If your cat's having a seizure every 3 weeks, then absolutely they do need medication to stop that from happening. So seizure diaries are a really important part of dealing with a cat with seizures. So really, I think the really important thing for you to remember is it's very, very rare for a cat to die during a seizure. Most seizures are quite short-lasting and cats come around from them. So it's shocking and terrifying when your cat has a seizure, but if you stay calm and do as I said, then things should be all right until you get to the vet, and the vet will then help you through how to manage this in the safest and most effective possible way.